Hello, everyone, and thank you for tuning in. In this episode, Dr. Susan Taylor will share some highlights and clinical pearls regarding the treatment of acne in patients with skin of color. Dr. Taylor, can you highlight some of the systemic issues that contribute to a lack of knowledge about acne in patients of color?
So there are several systemic issues that contribute to the lack of knowledge about acne in patients of color. First of all, there is inadequate training in regard to patients with skin of color. And in fact, there was a survey that demonstrated about half of dermatologists, as well as residents, reported that their medical training was inadequate for conditions that occurred in Black patients. In addition, there was another survey that looked at both chief residents as well as program directors. And the vast majority of them, like over 80%, said that they did not have a skin of color clinic in their institution. And about 3/4 said that they did not have lectures on skin of color by an acknowledged expert. So number one, dermatologists and trainees are not learning about acne. And the second systemic issue is the lack of diversity in clinical trials. And that has been demonstrated and documented over the years. Now, more recently, there has been more diversity in enrollment of patients with skin of color in acne in particular, but it is not, let's say, for all of those trials, not reflective of the US population.
Dr. Taylor, can you explain why it is important to treat post-inflammatory hyperpigmentation alongside acne, particularly in patients with skin of color?
Well, in patients of skin of color, they often present with post-inflammatory hyperpigmentation rather than the acne that has caused the post-inflammatory hyperpigmentation. When I perform a physical exam, I often see very few papules or comedones, for example, but rather what's most impressive are the large number of hyperpigmented macules. So if I give a patient an acne medicine and not a medication for their post-inflammatory hyperpigmentation, that's not going to be a patient who's pleased with the care that I have rendered. So I do emphasize with my patients that I am treating both their acne as well as their post-inflammatory hyperpigmentation.
Dr. Taylor, are there any unique considerations that must be taken when prescribing treatment for acne patients with skin of color?
The most important consideration that must be taken into account when treating acne patients is that many of our topical therapies, particularly retinoids, can be very drying and irritating to the skin. And that can then go on to produce further post-inflammatory hyperpigmentation. Patients can be very troubled by this. They already have a baseline of post-inflammatory hyperpigmentation. So it's critically important to improve the tolerability and lessen the chance for adverse events like dryness, peeling, redness, for example.
Can you tell us which acne treatments have been studied specifically in patients with skin of color and briefly touch upon the safety and efficacy of those treatments?
Well, there have been actually more recently several studies that have demonstrated safety and efficacy across the spectrum of races and ethnicities. Let's just focus on some of the more recently developed products. There is a tazarotene lotion that has been tested in whites, Blacks, Hispanics, and non-Hispanics, where the efficacy has been demonstrated as well as the tolerability in individuals with skin of color. Likewise, there's a tretinoin 0.05% lotion that has been examined in skin of color populations, particularly Hispanic and Asian populations. And again, safety and efficacy has been demonstrated with those two new novel retinoids. And I mention the retinoids because, as I said previously, they are the agents that we're particularly concerned about tolerability and adverse events. So that gives you a little bit of an idea of the spectrum. There's also a new to the market, relatively new to the market, product that contains the retinoid adapalene, 0.3%, as well as a benzoyl peroxide. So it's a combination products. And combination products have gained popularity in the recent years because of their ease of application for patients. And there was a study that, again, demonstrated in darker skinned individuals safety and efficacy. So that's yet another one.
Thank you, Dr. Taylor. Is there anything else you'd like to add?
Well, I think it's critically important for all dermatologists to be comfortable with the acne patient and understand the implications of the tolerability of various medications. I would also like to point out the effect on quality of life and perceptions of self-confidence of these patients. I think it is profoundly affected by acne. And the appearance that acne can cause the patients to present to the world with. So I want all of my colleagues to realize that acne is far more than a cosmetic issue, but profoundly affects patients, particularly our skin of color patients.
Thank you so much, Dr. Taylor, for sharing these highlights and clinical pearls.
Thank you.